Hello, my name's Dr. Paul Matthews. I'm a physiotherapist here at NUH, and I'm going to tell you about the VACOped boot and how we use it in your early Achilles tendon rehab. In the bag there's a low sole. You don't need to worry about that for quite a few weeks, so just keep it at home and we'll let you know when you're going to use that. There's the main boot. And in the boot there's a spare liner which we'll talk about. There's also an instruction booklet. You'll also be provided with one of these leaflets that will tell you a lot more of the other information as well. So you can see the configuration of the boot here. It's got a large rocker on it that you'll see later enables you to walk, but also specifically you can see this angle here. The purpose of that angle is to ensure that your Achilles tendon, the two parts of it, are held as close together as possible. Good idea with the straps is just fold them back on themselves, otherwise, like most things with Velcro, you end up with a big ball of Velcro. The front cover comes off, and we can open it up. And I'm just going to show you why it's called a VACU for vacuum. Inside the lining, there's this white inner that's full of polystyrene beads, and there's a pump. It's actually a vacuum pump. So if I just hold that like that, that sucks the air out, and you can see that holds its shape and becomes quite firm. So this will mould around your foot to make it unique for yourself. So the shell of the boot, as I said, holds your foot at an angle, and it's going to help bring the two parts of your tendon as close together. It's got triangle buttons here and here on each side. If you squeeze those, you can take the sole off, so you don't need to go to sleep in what you've been walking around in. Because the boot you will have on 24/7. The only time it's going to come off is when you need to check your foot for hygiene purposes and to check you're not getting any sores, etc. It slots on here, there's clips on there. All of these are also on the manufacturer's video clips, and there'll be 2 clicks to go on. This part and the adjustment in the back, you don't need to worry about that at this stage. You will be informed when you need to start changing that, and there's a key there that goes with it. My advice is early on, take the key off, put it somewhere safe, because it will get knocked off. So when you're resting and your foot is out of the boot, so you have to change the liner, etc., always keep your foot pointing down. Okay, at no time should you pull it back in this position. Always toe or foot pointing down. Putting the boot on in that position, you can scoop the foot in, layer the Velcro over, and then slide the foot into the boot with it pointing down. And get the straps out. The shell goes on. The straps are numbered inside. This is the most important one to put on first because it's going to run around here, so that will tell you you've got the shell, the top shell, in the right place. I want to get this valve above that line, so I'm just going to give that a pull. If I pull at the back here, it'll just help any creases come out the back around on the tendon, and now you can see we've got a little gap there. The shell tucks on the inside at the bottom and at the outside at the top. Now I can just tighten them up again. When you first put it on, you might find there's a lot of pressure as it tries to push your foot down. And if I put my fingers here, there's a little triangle bit. I can feel the back of the boot there. There's a little bit of a gap. So So I probably just want to loosen them off and just make sure I've got my foot right at the back of the boot. That's better. Over the weeks, everyone gets very, very good at doing this a lot quicker. How tight? I'd say I can wiggle that quite easy, so I'm just going to tighten it up a little bit more. That one's way too loose. That's a bit better. And that one's okay. In this position, I'm now going to suck the air out. Normally takes 5 or 6 pumps. And you can see there now, the suction there. And maybe twice a day, just give that another couple of checks. And there we go, that's how you put the boot on. So when standing with the boot on, because of the extra height of the heel, it really distorts your body. So I can't lock my right leg and stand unless I go onto my tiptoe. So what we're going to do is try to bring this foot up, my left foot this side up, to try and match here, because to try and walk otherwise, the only real way to do it is I have to walk on the toe. The big issue with walking on the toe is that my foot is sliding down here, the toe's coming out, I'm getting stopped by going because of pressure here and here, and I actually risk getting sores on the top of my foot, on the shin, but also that inner bead bag takes all the force and they often split, and unfortunately we can't keep replacing them if they split. So to help increase the height of the heel, yes, you can buy shoes, or you may have shoes with a great heel. These are fairly low in case. So almost the first bit I'm going to do is take the insoles, and on my right I've got orthotic insoles already, so I'm just going to put those together so it just doubles things up so they're a little bit thicker. If you've got some heel wedges in, you can try using those. That's one of the orthotics, it's just dropped out again. So that's going to bring me up a little bit, but supplied by the boot company as well, they have what they call an even up. I'm going to put that on my shoe as well. If you've got a pair of hiking boots, that may work, but you probably want to get some type of wedges inside as well. You'll notice at no point did I say this is comfortable. And we'll see now when I stand, I'm a lot more even. And then when I walk, I can actually step through a lot easier. I can also start to get the mid of the sole, if not the heel of the boot, touching the floor first and roll through. Now I'm doing this without elbow crutches. Of course, when you're first starting, it's perfectly normal to have elbow crutches. You may still want to use your elbow crutches if you're outside and it's a busy area, or if the weather's just terrible and you don't feel so confident. That's perfectly fine. But after about 2 weeks, if you're walking without crutches, that would be great. As long as you're walking with a good style, so you're not doing the bit on your toe, because I said before how that actually potentially hurts your foot by the pressure here and here, but it also damages the boot, and it won't stimulate your tendon to start healing so well. So the real thing is foot down, being able to roll through. Okay, I'm just going to show you how to change the bead liner. Every time you take the liner off, pull the valve off, up, let the air in, give it a shake. Even if you're not changing anything, grab it by the toe, give it a shake, because it will help the beads come down here, and you'll see why. Because if I just unzip it all the way down, bring these pieces out, just bring the valve out a bit more carefully. Hold the toe there, this will come up. When I was holding up, shaking it down, it's shaking these beads out of this bit through, and some of them go through this little gap. After a few weeks, You may find that there's not too many beads up here, but too many in here. So just work it down and just let them feed through. To put it back in, make sure it's the right way round. So you've got the valve here and going to go into the hole in the inner. And it's sometimes helpful just to take a little air out, just so it's a bit easier to work with. I found it easy to slide the toe in first, then these two sections, zip up a bit, and feed through with the liner and the valve. Through again, then finishing zip it. So we're changing it if it's wet, because you don't want wetness in the liner against your skin, because it will help deteriorate your skin. If it gets a little bit too dirty and sweaty, which inevitably it will do, then these are machine washable, but definitely take out the bead liner.